Good evening, everybody. It's Dr. Galvin here with today's coronavirus update. For those of you new to the video, my name is Dr. Jeffrey Galvin. I'm a board-certified emergency medicine and obesity medicine physician. I still work shifts in the emergency department. I'm also the founder and medical director of Vitality Medical Wellness Institute, where we focus on high-end functional health, athletes, executives, optimizing human performance. We also deal with weight loss and hormone therapy, always trying to reverse chronic disease and get people performing better. As usual with these updates, I'm going to start with the numbers. Today, worldwide, 3.6 million cases, 253,000 deaths, but 1.2 million recoveries worldwide, which is good news. Here in the States, 1.23 million confirmed cases, 72,000 deaths, 163,000 recoveries. Here in my state of North Carolina, around 12,000 cases, 452 deaths. You know, that 72,000 number is up 2,500 from yesterday. So about 2,500 people have died of COVID in the last 24 hours or so. I think that we've talked a lot about reopening the economy and how important that is, and I've talked about the Swedish model and my thoughts about how to proceed forward, but there's a great desire in the country to get moving again, and I think we've got to do due diligence and understand that there's some calculus here. We're going to cause probably more death by opening up, but we're also going to cause death if we don't open up, and so we've got to figure out what our balances. Where does it fit? You know, what is an acceptable number of deaths versus an acceptable number of deaths from not doing anything, keeping the lockdown going and destroying the economy? There are some states, I think, that are doing it well and that they've actually seen decreasing cases for 2 weeks and they're ready to go on to the next phase. There are other states that aren't seeing that but are opening up anyway. There's lots of people protesting against it, lots of conspiracy theories, and we'll talk a little bit more about that tonight. I do think we need to point out that the University of Washington just today came out with a new model and some projections of potential numbers of death if we open up like we're doing. So with the assumption that 31 states are going to open up their economies by May 11th, their model now predicts roughly 135,000 deaths in the U.S. by early August. And that range of predictions is between 95,000 and 243,000. So realize that this is not going away just because we want it to. Magical thinking doesn't make it go away. So we need to continue to protect ourselves. We need to continue to protect each other. We clearly need to reopen the economy, but we're going to have to really do a due diligence in terms of surveillance, quarantining people that are sick, contact tracing of the people who've been around those people, and having a short leash to pull things back if it gets out of control. I mentioned conspiracies yesterday. I've been bombarded, and I want to talk about some things that have been going around the internet. I think a lot of people have seen them. If I've seen it, 20 times, I'm assuming other people have seen it too. People have sent me stuff all the time. And one of them is this provisional death count thing from the CDC, and the claim goes that the CDC suddenly dropped the number of deaths from 67,000 to 38,000. And there's a link to this provisional death chart on the CDC website. And that's exactly what it says. The provisional death count is 38,000. Actually, I just looked at it. It was 39,000. But all it takes to understand that graph is to just read it. Read the description underneath it. That provisional death count is death counts based on completed final death certificates. And so what does that mean? It means that the death certificate needs to be filled out and filed. About 80% of those death certificates in the US are filed electronically. About 20% are filed by paper still. So there's a lag of several weeks before that data gets there. So that provisional death rate lags behind the actual death rate by 1 to 2 to even more weeks. And so it's actually completely accurate. If you go and look at the excess death count, which we talked about yesterday, you can see that that's markedly elevated. And there's 60, 70,000 extra deaths that we weren't expecting this year. The other thing is that I've been hearing is, this is ridiculous because I don't know anybody and my friends don't know anybody that's got this virus, so it's fake. Well, that's what we call observational bias, meaning if you don't see it, you think it's not real. Well, let's think about it. 1.23 million cases in the States. 330 million people, that equals 0.4% of the population. So 0.4% of the population, a tiny fraction of the population. So it's very likely that you don't know anybody. Now, we happen to know quite a few people that have had it, and actually the people we know, often many of them are not in healthcare, but again, everybody's experience may be different. I have a lot of friends in New York City, a lot of cases there. If you're from Concord, you might not have cases, but I mean, as we're going to talk about a little bit later, you might. Nicole, who is a bartender and server up in, I think, Winston-Salem, sent me a question about, when she goes back to work, how does she protect herself? So if you happen to be a waiter or a waitress, a bartender, someone who works in a restaurant setting, how do you protect yourselves? Well, social distancing obviously is going to be difficult. So wearing a mask is going to help. Now, again, we don't think that masks are going to prevent you from getting exposed to the virus, but if you're cleaning a table and you come in contact with something and you touch your face, the mask will protect you there. Washing your hands every single time. Using your gloves if you're using them correctly. And I've actually got a video that I'm going to post on YouTube. We talked about this during the Facebook Live about the right way to use gloves. Gloves are one-time use. They're not designed to be used the entire shift. They'll be used to do one thing and then they're discarded. And I will post a video in the next day or so of how to do that safely. Again, on a very personal note, here locally, Andrew Bird, who is a local pastor, father, his wife Kelly, and we've all known each other for a long, long time. Andrew actually coached my son in baseball back in elementary school days at First Assembly, is deathly ill with COVID. He's been sick for 10 days. He took a turn for the worse yesterday, nearly got intubated, had a very rough night. We're getting some reports from the family that he's maybe doing a little bit better, but we know that sometimes in these severe cases of COVID, people get sick, they get a little bit better, which is what happened with Andrew, and then suddenly you get much worse. We are praying for him and his family, for Kelly and the kids. If you hear this, please add your prayers to the list. Andrew's a great guy, and I hope that he pulls through it. But again, this disease can strike home very quickly. So, as I always say, take care of yourselves. Our individual risk is low. We are going to get through this. The vast majority of us are going to survive this without getting deadly ill, but we've got to protect each other. We've got to protect the people who are vulnerable. Wash your hands. Look out for yourselves. Look out for your families. Look out for other people. Do the right thing. Hopefully we'll be able to navigate opening the economy and balance that with protecting as many people as we can. I'll be back tomorrow with another video. Everybody have a great night. I'll see you tomorrow. Oh, I always have to remember to tell people. I forget. They yell at me when I forget. If you like this, please like our Facebook page, follow us on Facebook, subscribe to our YouTube channel, and hit the little bell. And again, we'll talk to you tomorrow. See ya.